Hello everyone, I'm Dr. Prachee Kulkarni, fertility consultant, Ferty9 Fertility Center. Today I'm going to talk about 5 things polycystic ovary patients should know. So as we all know, the polycystic ovary is very common nowadays. It is mostly presented as irregular cycles, problem with conceiving, problem with losing weight, having early onset diabetes, having associated thyroid issues. So this is what I want to pass the message to the polycystic ovary patients, that the 5 things which they should always know about polycystic ovaries. So first and foremost important is polycystic ovary does not always mean the sonographic appearance of the ovary only. So other than the sonographic appearance of the ovary, which we call commonly as polycystic, poly means multiple, cyst means small pocket-like fluid-filled lesions. So polycystic is multiple small pockets of fluids or bubbles of fluids in the ovary. So other than that appearance on the sonography, polycystic ovary actually is a endocrine and metabolic disorder wherein there might be multiple issues which are present. So the most important is insulin resistance. So the PCOD patients cannot process the sugars as other normal people, and there might be higher levels of fasting insulin, or they may have issues with processing the sugar, which will predispose them to develop a diabetes mellitus at a younger age. So this is about insulin resistance. Then another issue they may have is having the high levels of male hormones, which may present as having excess of facial hair, having coarse and thick body hair, having pimples or acne. So this is what we call is hyperandrogenism. So this is another hormonal issue associated with polycystic ovary. So also PCOD is known to be associated with hypothyroidism. We see hypothyroidism more often in polycystic ovary patients. Sometimes what we have to consider is PCOD can be secondary to some other issue. So PCO appearance of the ovary on scan is a separate thing, but it might be not the original or primary problem, but the primary problem can be somewhere else, which in some cases can be in the another endocrine gland, which is adrenal gland. So there might be adrenal gland tumor, or there might be Cushing's syndrome, or there might be some enzyme disorders of adrenal gland which can secondarily cause polycystic ovaries. So such patients might tend to have blood pressure on the higher side, might tend to have high blood sugar levels. So if you're having this polycystic ovary pattern on the ultrasound, you have to consult a proper fertility specialist to evaluate your polycystic ovaries properly and guide you properly. So this is the first factor about the PCOD. Now the second thing that I want all the PCOD patients to know is not all polycystic ovary patients are overweight. Suppose if you are underweight and you have irregular cycles, it doesn't rule out polycystic ovaries. Because as I mentioned just now, it's a endocrine and metabolic disorder. It's not just the appearance of the ovaries on the sonography. So even if you are normal weight, or even if you are leaner or thinner body build, doesn't mean that you may not have polycystic ovaries. And also when you are on the higher weight side and you have irregular cycles, your irregular cycles may not always be because of polycystic ovary. There might be other endocrine problems, or there might be other problems which is causing irregular menses even in the patients with higher weight. So higher weight may not, with irregular cycle, may not always mean PCOD. If you have normal weight, or if you are thin or lean, it does, and you have irregular cycles, it does not rule out polycystic ovary. So you need to consider visiting a fertility specialist and get yourself evaluated for polycystic ovaries. Now, third thing which I want you to know is having regular menses does not always equal ovulation. So some patients assume if I'm having a regular cycle, that means I must be ovulating every time. So it may not be true for PCO patients. There are polycystic ovary patients who may have regular cycles, but they may not ovulate every cycle. So why the bleeding happens in PCO patients is the lining of the uterus, which is developing under the influence of estrogen and progesterone coming from the developing eggs from the ovary. This lining of the uterus has to undergo certain changes. It has to get ready by the time ovulation happens, and it has to support the pregnancy after ovulation. So there is estrogen hormone level which is maintained, which is causing the growth of the lining. And once the ovulation happens, the progesterone comes and again supports the lining. So, but what happens in PCO patients is this growth of the egg or development of the egg is not proper. It also results into improper levels of estrogen hormone levels. And if suppose this estrogen level drops due to some reason, because the egg is not growing further, then that causes withdrawal bleeding of the lining of the uterus. So this is the lining which was supported by estrogen so far, but now that since the egg is not growing, the estrogen level has dropped. So what happens is this lining also sheds off. So this results in the menses. So even without ovulation, the period bleeding may happen regularly in some PCO patients. So this is the third point which I wanted to tell the PCOD patients. So now fourth point is, if you have polycystic ovary and if you have completed your family, means you are not interested in fertility anymore, you already have children and you still persist to have irregular cycles, please do not ignore the irregular cycles thinking that it's okay, I have children, I am not interested in having further pregnancies. So even if the periods are delayed, it's fine. So please don't consider that, because what happens is, because of the abnormal levels of estrogen and the prolonged exposure to the estrogen, there might be some abnormal changes which may happen in the lining of the uterus, which is endometrium. And these changes can be sometimes pre-malignant or even cancer-like changes. So if you are having irregular, delayed cycles, please do not ignore it. Consult your doctor. If you are having irregular cycles, other than your lifestyle modification, what you may have to do in such cases is take regular medicines with your doctor's consultation to bring the periods at least at the gap of 45 days. So if you are having irregular cycles and you have completed your family, please don't consider that it's fine to have late or delayed cycles, because it may result into something which might be more medically more threatening. So please do consider visiting your doctor and taking medicines to get regular cycles. Now, the fifth and the most important thing I want to tell all the PCO patients, though we treat polycystic ovary patients with different supplements like myo-inositol, vitamin D, and even metformin, most important thing is lifestyle modification, which we all know, and everybody is hesitant to do that lifestyle modification because it requires extra effort from your side. So I request you all to please put in that extra effort to modify your lifestyle, avoid junk food, have healthy, balanced diet, have foods which are rich in proteins, have low carbohydrate diet, try to include more salads and sprouts in your diet, avoid alcohol, have regular exercise at least for half an hour for 5 times a week. And this is about the lifestyle modification. Have proper sleeping time schedule for yourself, and maintain a healthy weight, maintain a healthy lifestyle, and this will go in long way to help you deal with your polycystic ovaries. So thank you so much.